you should.
All right, why is that?
To build their bone.
Right, so they're trying to maintain their
Bone
bone
mass.
structure.
Yeah.
So this is a very common experience with higher instances of women who are underweight because they don't have very much impact on the ground. Okay, last one, whenever you guys are ready.
Right. Ready?
What's your group number?
We're number 4.
I think they're 4.
So we had a pregnant client. Our scenario was that she was 3 months pregnant. She did some at-home workouts sporadically, but this is her first time in a traditional gym setting, and she came to us for unnecessary weight gain. So our general concerns for the population of someone who is 3 months pregnant or just pregnant in general is one, hormonal changes. They are more prone to being dizzy, and also the hormones in their body helps relax their joints. So they're going to be, so one of the things that we want to do and keep in mind is no joint stress or impact on the joints as we train them. They're also more prone to overheating, so we're going to monitor the room, how they're doing, check them in, check on them, and then also make sure they're getting plenty of hydration. They're also more prone to fatigue and nausea, so moderate and shortened sessions is the best way to get optimal results without risk of fatigue, nausea, and any sort of like complications within the workout. Also, resting heart rate and blood pressure are increased. So their target heart rate will need some adjustments, and throughout the exercise, we'll ask RPE to see how they're doing. Avoid any pelvic floor pressure or strain, so we're going to prioritize stability with the core instead of strength. And then kind of the bottom one is like kind of not really a long-term goal, but something to keep in our mind for as we progress with the workout, that as the baby grows, we want to avoid going into like a supine position as the uterus will repress her blood flow. And then specific considerations for this client. She has no experience in the gym, no experience with gym equipment, as she said that she's never gone to a traditional gym. So we're going to, as we work her out, especially in the beginning, we're going to demonstrate safety and explain the usage of the equipment. And then she's deep condition and prone to fatigue, so start her out on a low intensity, work our way up to moderate, and do longer warm-ups. And then psychosocial, she's more likely to have anxiety and feel a little bit uncomfortable working in a gym setting, and so we're going to offer a supportive environment.
Okay, so some of the basic fitness assessments we want to do is body composition. She doesn't want to gain unnecessary weight, so we're going to keep track of that and explain caloric expenditure and kind of the added calories she's for her baby. And the manual resistance strength test, just to get an overall idea of how her strength is in general before we start putting her lifting weights on machines. Flexibility tests, so with pregnancy there's joint laxity, so I think it'd be a good idea to see how flexible she actually is. Maybe some people are way more, like kind of see how big of a problem it is. Also, there can become some imbalances with pregnancies, like I think the lower cross syndrome happens a lot for center of mass issues. So if she's having any areas of discomfort, you can assess those, so like hip flexors. And then balance test, we don't want her to fall. So we can do a star excursion, or we can do standing on one leg and foam.
I would just like to add with body composition, what we probably do is mainly, you can do it in body, it's safe, but there are some precautions. We with air volume. So we could do circumference, we could do skin fold measurements, but the abdominal area is obviously not going to be as accurate, and we could do takeoff. And then for the strength test, we would want to, although it's not her goal, we might want to educate her on like how improving her strength can help with delivery later on, like late pregnancy and postpartum recovery.
And there's increased diminishing bone density with pregnancy also. Okay, so for the EXR meds, we would also do cardiorespiratory, so we should have done a cardiorespiratory fitness assessment as well. Some maximal, we can do something as simple as Bruce walking on the treadmill, or like on the cycle ergometers, as weight bearing. And then, so we do that, light to moderate intensity, 3 to 5 days a week, 30 to 60-minute sessions, just on your basic cardio equipment machines. And then for strength training, we want to stay more in the light to moderate intensity. So you do machines, body weight. There's some free weight exercises you can do that's not overbearing. And yeah, so the rep rate is 8 to 12 or up. Around 2 to 4 sets per set. And then 2 to 4 days a week. Then we can do, if she is having some discomfort in those areas that we found that were maybe tight or short or high, 2 to 5 days, 3 sets, 30-second holds, and then some balance exercises. With the balance, we do want to make sure she's like near something that she can catch herself, or holding on, or close to something she can hold on to, or if we're there with assisting her. So we don't want to actually have her fall with the child. And yeah, so I was thinking 3 to 5 sets, 30-second hold, pretty much, depending on the balance test.
And then one thing we forgot to mention in the assessments is that the cardiorespiratory fitness assessment would probably be either on a bike or doing an arm ergometer. Bruce tests, maybe pushing it a little bit for high impact, but also like I think the leg ergometer and arm ergometer is probably the best options for us. And then long-term goals, we didn't add the slide because we didn't have time, but long-term goals, build foundational strength, focus on muscle groups that can help with later pregnancy as well as delivery. We're going to be working on infant part cardio endurance, so through heart and lung function. We're going to do low impact modalities, influences energy levels, circulation, and recovery from exertion. Our main goal is to maintain healthy weight gain, so we will continue with that, and even we'll monitor that like in the beginning. We can monitor it in pregnancy just to see where we're at, and then we can also do postpartum if she's interested in postpartum recovery, postpartum weight recovery, whatever. Pelvic floor stability and function would be maintain shock control during pregnancy, aids in postpartum recovery, and kind of like something we'll work on throughout the whole exercise whenever she's with us is just improvement of confidence and independence of being in the gym with us, making sure that she feels comfortable and being heard and getting the quality care that she needs to do.
So basically they would assess flexibility, but
where, it's very important to think about even the position, right? You said nose supine, things like that, so flexibility, and then to think about, what muscles can we stretch where it isn't a balance issue, where she's not supine, where, Huh? Yeah, relaxing hormone, right? So like I guess what I'm saying is, when you do an assessment, you just wanna make sure you're finding areas where they need to improve, right? Or maintain. So obviously maintaining flexible muscles and, appropriate joint laxity and things like that is important. But it might not be something that we're doing quite often, does that make sense? Depending on where, she shows, short muscles and things like that. But there are, you're gonna have to be a little creative on how to assess certain things with the pregnant woman because of, so those are all kind of cohesively things you're gonna have to think about. But relaxing, it's just gonna make them a little bit more, the joints a little bit more relaxed, and because of that, their muscles tend to, be more, overcompensating sometimes, okay? So, for instance, like females who have, do a heavy weight training sometimes get a little bit more neck pain, because during their time of the month, they also get more relaxed. So sometimes their muscles kind of like, try to keep everything in its structure,